What a time we've had today. We've got the brand new plan for the NHS. 10 years. 10-year plan for the NHS. It's going to be wonderful. My personal highlight is a doctor in your pockets. Oh yeah. A doctor in your pocket. That's exciting. That doctor, by the way, is your phone. There's no Honey, I Shrunk the Kids stuff going on. No. It's your phone. I don't think it's a great plan. Listen, before we get on to the 10-year plan, the 3-point 10-year plan, that's the 3-point 10-year plan. We've got to talk about Rachel Reeves. Rachel Reeves pitched up and she was there. She wasn't planned to be there. This is about the NHS. So we had Wes Streeting, who's the Health and Care Secretary, and we had the Prime Minister, who's the Prime Minister. And then, as a surprise guest right in the middle of it, they introduced Rachel Reeves. I was shocked. My colleague Diane, she was shocked. And Rachel Reeves looked impeccable. All the makeup, all the smiles, all of that stuff. Afterwards, Keir Starmer was asked a question. They said, "Are you happy to just bring out your Chancellor to smile at the cameras like it's some kind of Miss World competition?" I added the Miss World competition. And he was like, "Yeah, it's all good." So what happened? He comes out to do this big speech, and he comes out and starts with nothing positive. He comes out and starts, well, the Conservative Party, they're pretty rubbish, aren't they? The Conservative Party, don't like them very much. They didn't do very well for the NHS. If you're really positive about the NHS or your plan, why start with saying how bad the Conservative Party are? Like, my neighbours don't do their garden very well. But when I'm doing my garden, I'm not just walking up and down and saying the neighbour's garden's rubbish or whatever. I mean, that analogy didn't make sense. Here's the plan. Right. Here's the basics of the plan. We need to make sure that the health service is not just a helping out. It's not just curing you. It's not just solving the problem. It's preventing the problem as well. So we're going to use probe vaccines. We're going to have more screening, earlier diagnosis. We're going to work with the supermarkets to get healthier food into you. We're going to get mental health sorted. We're going to stop. Already we're stopping smoking. I have to say, getting mental health sorted. I live with bipolar, right? And I've not seen anything from this government to really help mental health. But we'll see. They talk about it. So we're going to shift away from sickness to prevention. And then they want hospitals. They don't want you to go to hospital. They want you to go to like a neighborhood clinic, a neighborhood hub. So in your hub, you're going to have your GPs, you're going to have your nurses, you're going to have your mental health people, but you're also going to have like employment people who help you into employment. You're going to have smoking cessation because being in work makes you healthier. I mean, so the statistics all say that people in work are healthier. I mean, you could also argue that they're in work because they're healthier, but there we go. And we're going to have one of these centres in every community, and you are not going to need an appointment. You will be able to get into your GP's surgery without an appointment, and they've talked for a long time about ending that 8 a.m. scramble. I don't know what's like where you are, but we always have to call at 8 a.m. to get an appointment if one of the kids is ill, or even if we're ill. I hate to think that would happen. And then he talked about the digital health service. We've got to move from an analog health service to a digital health service, which includes like AI. I just don't think AI is that helpful. Right now, I don't think that AI is that helpful yet. genomics, I mean, just whatever, and robotics. But it'd be really cool if those things worked. It would be really cool if those things worked. I think tech bros lean into them. But right now, are they going to help? Anyway, the plan is, it's a 10-year plan, I suppose, so maybe in 10 years that'll work. That gives the NHS staff, the human NHS staff, more of an ability to use their time to help you and look after you in a way that only humans can. So humans can human, everything else can be done by, robots or AI or whatever. I wonder if that means that porters are going to go. It's tricky. And Keir Starmer did a little thing where he said, everyone get your phone out. And no one got their phone out because, the people behind him didn't, because he uses people like scenery, which I think is really distasteful, but everyone does it these days. Get your phone out. And then he did the big reveal and he said, on your phone, you will see lots of apps. Of course, you're going to see apps on a phone. It felt like it made me cross. But he was talking about the NHS app. And then he listed the things you're going to be able to do on the NHS app, which is reorder prescriptions, book a GP appointment, see test results. All of those things you can currently do on the app that was set up under the Conservative Party. I do all of those things on the NHS app right now. But he said maybe you can look at your waiting lists. Maybe you can look at all kinds of things as well. How long it's going to take to get into the hospital. We'll see. But he said it's going to get better and better and better. He said you're going to be able to get live chat. You're going to be able to look at things 24 hours a day, 7 days a week. He said it's going to be a doctor in your pocket. I don't see how it's going to be any more than WebMD, if I'm honest. But listen, how significant is this? Shift away from sickness to prevention. That's rhetoric and not very useful. I'm not sure we're going to see any of that really. Neighborhood places, I mean, that sounds good. Are they going to be funded well enough? Is it going to make a difference? That is completely, it remains to be seen. And the digital health service already exists. And they say they're going to make it better. So for 29 billion pounds, it doesn't feel like we've got very much. It feels like a lot of rhetoric. He told an individual story. Of one person who had been told they weren't going to get any health care, and then they've got health care. He said that's the Labour promise. But the problem with that is that everyone's got individual stories and they are not all positive. So if someone has a bad experience in NHS, is that also the Labour health plan? Individual health stories don't work unless all of them are good. Anecdotal evidence is not evidence. Anyway, let's hope the stuff works. I just want to say thank you very much for joining me today. We'll see you soon. Love you, bye.